Hello, my name's Caleb, and I'm making videos about using AI in the field of medicine. In today's video, I want to talk about an exciting research project that I worked on where we used an AI-based CAD model. CAD stands for computer-assisted detection. So we use this model to predict the number of lung nodules for metastatic colorectal cancer patients. So let me start by summarizing what this study was. So let's say that there is a patient who has lung cancer and they come in for a diagnosis at this academic institution that I'm working at. What the physician will do is they'll use a computer-assisted detection software, and this software is actually, it's based on an AI model that's been trained using neural networks on a bunch of imaging data from the past. Because these models are so robust, they're able to predict whether or not a patient has lung cancer with pretty high accuracy. So this CAD software, it's actually becoming more and more implemented in the detection of primary lung cancer. But for our study, we were looking at whether this software could be repurposed and used in a different setting. So in this different setting, we looked at cancer patients who didn't have primary lung cancer, but they had a secondary lung metastasis. So that just means that, so let's say a person came in to the hospital and their primary form of cancer was colorectal cancer. And then they had a situation where the cancer metastasized to the lungs. The way that the cancer actually manifests in the lungs are as these nodules. And let me show you what this looks like on a CT scan. So if you look at this image, you can see that this circle, this is one cancer nodule. So they manifest as these little masses and they pop up all throughout the lungs. Here are some other pictures. Yeah, you can see that the arrow is pointing at this nodule right here in the lungs. This is actually a better picture because you could see that the cancer nodules are more conspicuous in this one. So in the current literature, as far as I know, there are no studies that tried to use AI software to detect metastatic lung cancer. The reason that this is that the standard of treatment for metastatic disease has always been to go to palliative care. What palliative care is, it means that you're not actually trying to treat the cancer anymore. You're just trying to alleviate suffering and improve the quality of life for this patient until they pass away. There are these innovative treatment options now, such as local ablative therapy that includes a surgery, and then it also includes radiotherapy. This new additional therapy on top of chemotherapy will allow for the actual treatment of metastatic disease. And there's also this new emerging idea. Well, it's not so new, but it's within the last decade. Physicians are starting to reconceptualize what metastatic disease is. So rather than being this binary condition where either you have metastatic disease or you don't, it's being described as existing on a spectrum. So figuring out and identifying where a patient lies on this spectrum of severity, it becomes important because now there are these new forms of therapy that could actually treat metastatic disease if it's less severe, rather than putting a patient on palliative care. But in order to figure out where a patient lies on this spectrum of severity for metastatic disease, first you need this mechanism to figure out where a patient lies on this spectrum. And one of these mechanisms could be to actually count the number of lung nodules. More nodules that are appearing in the lungs usually means that the condition is more severe. Whereas if you have just a couple nodules, it could be a less severe case. So as I was saying, this software that was originally trained to detect lung nodules in primary lung cancer, it was being used for our study to detect lung nodules in patients who have primary colorectal cancer but secondary lung metastasis in order to figure out where a patient lies on this spectrum of severity. So in this study, the patient population had this condition of colorectal cancer with secondary lung metastasis between the time period of 2006 and 2018. So over this 12-year time period, 50 of these patients were selected. All their imaging data was gathered, so every CT scan that they took. And what happened was 2 independent readings of these scans took place. In one appraisal of these CT scans, a radiologist was tasked with going through every single CT scan for these 50 patients. So there's around 80 CT scans per patient. You would do 80 times 50. That's 4,000 CT scans that this radiologist was going through. And what they were doing was they were counting every single lung nodule in all 4,000 of these scans. In the other group, you had a physician who was using this CAD software, so the AI software, and that was assisting this physician in predicting the number of nodules. So you had these two independent, one using AI, one not using AI, to figure out and count the number of lung nodules in all these patients. Since the radiologist was the expert, he specialized whether or not to read these scans and diagnose whether they have cancer or not. His counting was assumed to be the ground truth, and then the other group, the CAD group, was compared based on that standard. And we wanted to see how precise the CAD AI software was compared to the standard. So we actually found a pretty high precision for the CAD group. What we found was that the sensitivity hovered around 80%, which is pretty good. And then the specificity was around 90%. And these both together determined the precision of the AI software in predicting how many lung nodules existed on these for these patients. These results are especially encouraging because the original software is actually designed to be used on contrast enhanced imaging, but we actually used it on non-contrast enhanced imaging because it was for patients with metastatic disease, and they were just getting their routine checkup. So as you could see, the results of our study show that it does seem feasible that a CAD software could be used to detect metastatic lung nodules. Another very important thing to consider is the setting in which this software, this AI software, is being applied. The original purpose was to use it to detect primary lung cancer. In that setting, it is so important that you have a high specificity and high sensitivity, because the implication is that if you have a low specificity or a low sensitivity, it means that you could potentially miss a case of cancer, or you could falsely tell a person that they have cancer, which could have devastating consequences. But in the other setting that we looked at for metastatic disease, these patients already know whether or not they have cancer. The implications of a false positive or false negative doesn't determine whether or not a person is getting the treatment they need for their primary form of cancer. This is just an additional step to improve upon the standard of care. That's what this whole study is about. It's about presenting and introducing an additional way to improve the treatment of metastatic disease. Overall, I love this study, and I love that there's actually a new hope for patients with metastatic disease, that they don't just get put on palliative care, but now there's this effort to actually treat the cancer because we have the technology now to begin to do that. And this provides hope for a lot of different patients. And the results are preliminary, but they're very promising. And I think that as technology and the software like this improves, hopefully this will save a lot of lives. Thank you for watching this video. In the next one, I'll be talking about another exciting topic. I'll be talking about a research project that I contributed to that looks at a randomized control trial in using VR to mitigate anxiety right before breast cancer patients receive radiotherapy. All right, thank you for listening, and I'll see you in the next video.